Hello friends, welcome back to my channel. If you're new here, my name is Dr. Jaime Canada. I am a pelvic floor physical therapist and I'm so excited for today's video where I'll be showing you some stretches to help with tight pelvic floor. I think it's important to touch on that these are meant for guidance, but they are not prescriptions in any way. The best way to get specific help for your pelvic floor symptoms and dysfunction is to see a pelvic floor therapist. If you are someone who you believe you have pelvic floor tightness or have been told by a provider, hopefully these stretches will help to improve some of your symptoms and get you moving a little bit better. To start off, we're going to be doing some diaphragmatic breathing. Breathing is going to be the baseline really for any exercise when it comes to pelvic floor health, because the diaphragm and pelvic floor are synergistic, meaning they work together. So if you think about it, you have pelvic floor here, pelvic diaphragm, and then you have your breathing diaphragm. As you inhale, diaphragm is going to drop while pelvic floor drops and lengthens as well. So as you inhale, both will descend. As you exhale, both are going to come up. So with inhalation, pelvic floor naturally is going to relax, and exhalation naturally going to contract. So that can be helpful for future videos as well when we think about more of the control and strength. But today, relaxation is going to be very important. So we're going to work first on some breathing. So what I want you to do is find some area on your floor. If you have a mat, great. Maybe you're trying these in bed today, whatever is comfortable. So find your way onto your back. And I want you to place one hand on your chest and one hand on belly. So here, we want to see most of the movement coming from that bottom hand versus the chest. So as you inhale, you want to think about that bottom hand coming up, followed by the chest. So focus just on the inhale first. So inhale. And as you exhale, you're going to let the chest and belly slowly release. So I want you to try a few there on your own. And then once you feel like you get the hang of it, let's go ahead and we're going to try 5 breaths together. So go ahead and inhale. And exhale. And inhale. And exhale. 3 more. Inhale. And exhale. Good on these last 2. Really focus on that bottom hand. Coming as high as you can toward the ceiling. Inhale. Exhale. And last one. Inhale. And exhale. Good. As you're doing these breaths, you really want to think about keeping the entire body quiet. So really setting your environment up for success can be helpful as well. I know there could be a lot of moms on here, so you know, whatever you're able to do, but just like mind and body, if you can get everything to relax together, you're gonna find this a lot easier. So the next stretch we're gonna do is called Happy Baby. If you are a yogi, or you've probably done this if you have done any kind of like group class, this is going to be really great for helping to open up pelvis. Our adductor muscles or inner thigh muscles do attach at pubic bone, so I find a lot of the time patients will have tightness due to overuse of those adductor muscles. So you're gonna find, once again, a comfortable position on your back. I'm gonna show you a couple different variations here, depending on your hip mobility. You know, I'll be the first to admit that my mobility could improve. I'll show you a couple different options, and I want this to be a comfortable stretch. Stretches can feel discomfort, but any severe pain we do not want. So start on your back. First variation, you're going to bring your knees towards your chest. And you want to think about kind of creating a V with your knees. So the knees come out, and then you're going to pull them towards your chest and bring them out to the side. We're opening up, lengthening through pelvic floor here. And while you're in this position, I want you to think about doing some of those nice deep belly breaths. So with this, you can stay as long as comfortable. At a minimum, you know, holding for about 30 seconds, performing that a few times. I really like to do a gradual stretch, so I will typically start patients on about 2 minutes, if they can tolerate 1 to 2 minutes. Just holding that stretch and focusing on breathing. If this starts to feel like pretty easy, you're not feeling much of a strain, much of a stretch, then you can go ahead and bring your hands and arms kind of inside your knee, grab the outside of your feet, and you're gonna once again pull towards you and out. For me, this is definitely a challenge. You can even incorporate a little bit of rocking here. But once again, really focusing on quiet body and those nice breaths. It's finally sunny here in Michigan, so it's nice just to kind of look up out my my skylight here. And then carefully bring everything down. Good. So that's number 2. Number 3 is going to be in a different position. So this one can be a little tricky. It's called a deep stretch squat. I would recommend finding some kind of sturdy chair, something that won't move. I'm going to be using the doorknob. Please, please, please find something more sturdy. I do not have anything near me. You don't need to hold on to something, but I'm going to show you an option, and then I'll show you without. So we're going to get into this deep stretch. So pretending a chair is here, ignore the doorknob. You're going to have feet a little bit wider than hip. And I want you to think about pushing the knees out and dropping the butt back. So you shouldn't be over, don't think about knees and ankles over. You want your knees behind, sagging back, because you want to avoid putting pressure on the knees here. So it should feel relatively comfy here. You're just holding. Once again, the goal here is to open up pelvis, lengthening the muscles at the pelvic floor and those that attach near the pelvis. If you're feeling like that, it's easy and you have the mobility, you can do it without. For me, I feel a little bit more in the knees. You don't want to be leaning forward, but you can come against like a wall and do it that way too. And once again, holding here, this one's a little more spicy, if you will. I try to hold it about 2 minutes. These are ones you can do watching TV, right out of bed or before bed. If you can do it multiple times a day, great. And then coming out of that slowly. We're actually gonna stay on the ground here. So I want you to shift so that you're in a kneeling position. If you have any precautions due to knee surgery and you're not feeling like you can do this one, I'll show you another option. If you don't have any issues that you know of, you're going to have one knee down and then lengthen the opposite leg here. So you're gonna start where chest parallel with floor. So you're kind of in this 90-degree position with hips and torso and upper leg. And then what you're gonna do here is you're going to shift backwards, keeping that foot on the ground, and then shifting weight forward. So chest and hands are more in line here. This is called an adductor pause. As mentioned, adductors do attach at pubic bone and can be one of the muscles that contributes to tightness. But also when we're opening up pelvis here, we are working on stretching that perineal region as well. So starting out 5 to 10 on each side, and then you can work up to more sets or just timing yourself for a minute or two. This is one of my favorites. And it is a little bit more of a dynamic stretch, so you're not necessarily holding it, but we're getting to work through more of that hip mobility as well as lengthening at the adductors. If, like I mentioned, that's too much on you, you can do standing. And just working a side to side inner thigh stretch. Whatever is comfortable. The world is your oyster. Good. All right. So we're going to go through just 2 more for today. So next one is a bottoms up stretch. So you're going to be in kind of a squat position, and your forearms you're going to pretend are glued to your upper thigh here. You want your butt to sit back like you're in a chair. And then from here, keeping forearms on your legs, you're going to try to come to a fully extended position of the knees, feeling a nice stretch throughout hamstring, and then down. I like this a lot because you can change foot position to change the lengthening at pelvic floor. So you can be more in a neutral position, but you also can move your feet out into external rotation. And that's going to favor more of anterior pelvic floor. And you can hold this as well for about 5 seconds, or you can do more of that flossy movement. And then turning toes in slightly into internal. It's going to open up a little bit more posterior at pelvic floor. This is feeling very good for me. So I saved best for last. Wall series is my absolute favorite of the exercises I give, especially for when we're thinking about down training or relaxation at pelvic floor. It's a series because there are 6 different stretches within one. But I'm going to show you the series. We won't go through, the exact timing, but I love it because it gives you a lot of options, and it can be really beneficial, especially for those who have prolapse symptoms, because you're going to have your feet up on the wall, and that's going to help allow gravity to reposition organs that are descending. It's going to put them a little bit more into place, if you will, So I'm gonna readjust the camera and then we'll get into our last series of the day. Get positioned for wall series. You're gonna want to be sitting perpendicular to your wall or at your bed, which can sound silly. Whirl onto your forearms and then kick your legs up. From here, there's 6 different variations. So the first one is going to be a wide V. As you can see, my wall space isn't the best, but you're just gonna let everything go heavy and relax, letting everything lengthen. You can focus on your belly breathing. Typically, you're gonna hold each position for about a minute. So we'll just do a few breaths here. And then you're gonna let your legs come to straight ahead. You can start with this one too. I just love the straddle stretch. Here it's going to be a little bit more that hamstring lengthening. I love to do this after a run as well, to prevent any blood pooling in my lower legs. There's a lot of great benefits, especially like for circulation, to having the legs up. So combining that along with these stretches is just great for pelvic health in general. The next position is going to be a butterfly. So the feet come together, and knees are wide. I feel like I always get so relaxed with this. I'm like, I could just sleep like this. Then you're gonna take your feet flat against the surface, keeping the knees this 90-90. More in a deep squat simulation. And just continuing to let your body go heavy. You might want your arms out to the side, eyes closed. For this one, think about your belly kind of pressing into the upper thighs as you inhale and exhale, nice and slow. For the last 2, you're going to pick whichever leg straight, and then you're going to cross the opposite leg over like a figure 4. So here you're still getting a little bit of adductor, but also going to be stretching those deep external rotators of the hip. Let's try a few breaths here. And then let's switch over. So other leg straightens, other leg crosses over. So as you can see, I'm not right on the knee, just a little bit above the knee here. Going to carefully do the opposite. for getting out of this position. So I like to just kind of let my legs over, doing a nice log roll technique, and sitting up. Hopefully you're feeling so relaxed after that. I know I am. So these are going to be a great starting point for helping with any pelvic floor tension and overall working on relaxation and down-regulating the nervous system. I hope this was helpful. Feel free to comment any questions you have, if there's certain movements you'd like me just to focus on in separate videos, or if you're looking for modifications, so like regressions or progressions. I will be making more videos like this, and we'll talk about what to do if you're, let's say, on the weaker side with pelvic floor, as well as coordination and overall strengthening. But today is all about relaxation and down training the pelvic floor. So thank you so much for watching. Please subscribe and comment, and I look forward to seeing you in the next video. Bye.